I'd like to welcome Dr. Gonzalez from AKChiropractic in Plano, Texas. Dr. Gonzalez, why do we get headaches?
Okay, that's the same reason why we get any type of pain. So therefore we got to look at the source of the pain. When we get headaches due to, especially when patients will complain about around the sinus cavities, maxillary, frontal, those are definitely could be an allergy-related headache, or it could be an infection-related headache, sinus infection. We have different types where other patients will complain around the temporal area. Those tend to be more of a hormonal headaches. They go around typically when the estrogen drops, or estrogen and progesterone with your periods. They'll start complaining of their headaches. So we got many different reasons, obviously. Toothaches can cause headaches. Food allergies, and those are a little bit harder to detect because this is not the allergies that typically we eat peanuts and we break out in hives right away. But these are the what we call the body produces certain antibodies that are a delayed reaction, and therefore you can eat today milk, a dairy product today, and possibly have the headache 2 days later. So most people will not relate that. In these cases, we will order blood work to figure out what are the food allergies that could be causing the headaches. You got structural headaches. This is the type where it could be a jaw. The source could be the jaw. It could be the source could be the neck, where you have muscles tensing up, and these are typically classified more of your tension type headaches.
Okay, and what type of headaches do you treat?
Let's start with what I don't treat. We really don't treat headaches per se. We're looking at the sources of the headaches, the cause of the headaches, and therefore look to strengthen the body. But I can safely say that we're the ones I mentioned before. If there's sinus congestion, if we can identify the food, for instance, we can identify the food that's causing your headache, we're simply just telling the patient you need to eliminate this. And there are some things that we can recommend also to desensitize you to those headaches. So as far as treatment, we definitely treat with chiropractic your tension type, where if you have pressure in the jaw or in the neck as a source of the pain, we definitely go through what's called spinal manipulation or adjustments to get rid of that pressure that's causing the headache. When it comes to migraines, which is my favorite headache to treat, it is typically related to a cardiovascular, which means this is the patients that are mentioning that when there's a weather change, there's going to be an atmospheric pressure change. That means there's a fluid pressure change in the body, which causes the blood vessels to either dilate or constrict. And so therefore it's something that we treat typically with nutrition. In my case, one of the reasons why I love treating headaches is because as a kid I was getting headaches since I can remember. And as I got older and older, more stresses in my life, migraine headaches definitely got worse. Got to the point where medications just wasn't taking the same effect on them anymore. And it wasn't until I got tested, went through analysis, which is the same analysis that I do now, which is the applied kinesiology, that I was able to determine that it was caused by heavy metals on my heart. So detoxing my body was the answer to getting rid of my migraines. It may not be the answer to your migraine headaches, but something might be causing that stress in the heart, which is what we have to find out, and which we can determine in our office.
Okay, so then how is your treatment different from normal medical treatment?
Okay, good question. So medical doctors are typically addressing the symptoms. So in many cases, if there's a tension headache, they're going to be recommending pretty much your Excedrin type of headaches meds. If they're migraines, they also of course have the special migraine headaches meds. So, but they're just basically addressing the symptom, because as soon as the patient gets out of taking the meds, they're back to the same problem. In our case, what we're doing is we're actually just looking for the cause. So I know if I can find the cause of your headaches, then I know how to address it properly. So as I mentioned before, if it was coming from the neck, or if it was coming from food allergies, or if it was coming from a toxicity effect, we're doing the proper recommendations for those things.
Okay, so how does chiropractic care help get rid of headaches?
Chiropractic main is going to be addressing the tension type headaches. This is going to be basically the pressure on the nerves, pressure on the joints, and mostly coming from the either upper thoracic or the upper back or the neck, at the base of the neck. These are the headaches complaining in this area and over the back of the neck. But as far as our office, we offer more than just chiropractic. We're offering the nutritional support to get rid of the headaches.
Well, thank you so much for your time today, Dr. Gonzalez. For more information about AK Chiropractic in Plano, Texas, or headache relief or migraine relief, please visit akchiropractic.com.